Hi, my name is Francesco Bianchi. It's August 17th, 2019. And for the Unit 4 case study, I chose Case 2 and Case 3. So for Case 2, there are two types of amino acids, essential and non-essential. Essential amino acids can only make way into the body through dietary means, where non-essential amino acids are produced naturally in the body. One of the essential amino acids is phenylalanine. In the normal metabolism of phenylalanine, it is converted into a non-essential amino acid called tyrosine by the enzyme phenylalanine hydroxylase, or PAH. PAH speeds up the transformation of the essential amino acid phenylalanine to tyrosine. When PAH is deficient or defective, a disease process known as phenylketonuria can arise. This condition, where the normally non-essential amino acid tyrosine becomes an essential amino acid due to the fact that it is not being produced in the body naturally. In PKU, the signs and symptoms include irreversible intellectual disability, seizures, behavioral abnormalities, microalopathy, and skin disease. These symptoms are due to the accumulation of PHE in the brain. PKU is an autosomal recessive disease. This means that it can only be inherited if both parents are carriers or if only one actually has the disease and the other parent is only a carrier. There is also a chance that the child ends up without the gene at all. In patient A, in this case, it is noted that both parents deny any history of PKU. This is likely because both parents are only carriers of the genes, but they were never tested because they probably lack relatable symptoms. Since they are both only carriers and possess one copy of the gene each, they fortunately never developed the disease. However, the gene for PKU was passed to their child by each parent, who had a 25% chance of being affected by the disease, a 50% chance of being symptomatic carrier of the disease, and a 25% chance of not being affected at all. As stated before, phenylalanine is converted to tyrosine with the help of the enzyme PAH. PAH requires a cofactor to function properly. This cofactor is called BH4. Without BH4, PAH, even if present, cannot metabolize phenylalanine into tyrosine. Patients that are deficient in BH4 can present similarly to patients with PKU because the reaction of converting PHE to tyrosine is being inhibited. The chart we see in Case 2 shows that the levels of PHE after BH4 administration in patients A and B. Patient A, having known PKU, shows expected results that his PHE levels would elevate after a meal, which likely contains protein. The BH4 administered to the patient A has no effect on the metabolism of the PHE because this is the patient's PAH, because this patient's PAH is defective or deficient. In patient B, we see that the PHE levels decrease after consuming a meal with BH4. This patient has a normal PAH, however, is deficient in BH4 prior to administration. When BH4 was used as a supplement in this experiment, it was able to be used as a cofactor for PAH to fully function and convert PHE into tyrosine, decreasing PHE levels in patient B. So for Case 3, we see a case that shows a patient with great toe pain. He's diagnosed with gout, and his labs show that he has a high value of plasma urate and a low level of urinary uric acid. So based on this information, the cause of the patient's gout is option 3, decreased urinary excretion of uric acid. Gout is an arthritic disease in your joints caused by too much uric acid in the body. The fact that the patient excretes less than the normal range of uric acid leads me to believe that this is the cause of the elevated urate in the patient's plasma. If the patient simply had an overproduction of purines, like option 1 suggests, and normal kidney function, then the body would be able to compensate for this overproduction by excreting out that extra uric acid created by the excess purines. In fact, urinary uric acid levels would be higher than normal if this was the correct answer, because then the kidneys would work harder to excrete the excess uric levels. The purine salvage pathway is a pathway of purine metabolism. In this process, the products of purine metabolism, hypoxanthine and guanine, are combined with the enzyme HGPRT in order to recreate purines. This salvage pathway decreases the production of uric acid by creating a loop in the normal pathway of purine metabolism. The products hypoxanthine and guanine, which would eventually be converted into uric acid, instead form purines once again. Decrease in this salvage pathway, option 2, would lead to an increase in hypoxanthine and guanine, which would lead to an increase of uric acid in the body. Similarly to option 1, this increase of uric acid in the body would lead to the body to excrete more than the normal amount, raising the urinary uric acid levels. Since option 1 and option 2 should cause an increase in urinary uric acid, they are both the incorrect answers, leaving option 3 to be the correct answer. We see that the patient drinks a lot of soda daily, which has a lot of fructose corn syrup. Fructose, when broken down in the body, is converted into purines. These purines follow the normal purine metabolism pathway and eventually will be metabolized into uric acid. Diet soda, which does not contain high fructose corn syrup, would not lead to this amount of uric acid buildup. So that switch that he made from regular soda from diet soda is adding a lot of uric acid into his body.